Bladder or urinary tract infection. Urinary tract infection is an infection of any part of urinary tract, which includes bladder as well as urethra and kidneys. Bladder infection is an infection of the bladder wall, or a medical term is cystitis. How do you know that you have a bladder infection? Usually women develop, it happens to men as well, but symptoms of the bladder infection include burning when passing urine, frequent urination, needing to pass urine very frequently, inability to pass urine or passing only very small amounts of urine, cloudy urine, blood in urine, sometimes back pain, and that would indicate that infection has moved to kidneys, and foul smelling urine. When someone develops bladder infection, it has to be treated. Drinking a lot of water is very helpful. Using antibiotics is also going to help, and very quickly. Before you see a doctor, if you are not able to see a doctor immediately, there is a couple of preparations that you get at the pharmacy, such as citrus soda or urethritis, and both of those can help with symptoms of bladder infection. Doctor will do a urine test and prescribe antibiotic to treat it. When we receive urine test result, we may add a different treatment depending on what bacteria was found causing bladder infection. What precipitates or causes bladder infection? Usually it's a bacteria, E.coli, or other bacteria that live in the bowel and are moved to the bladder. So hence it's very important when you go to the bathroom to wipe from front to the back and not the other way around. Passing urine before and after sexual intercourse helps to prevent bladder infections. Using or passing urine regularly and not avoiding going to the bathroom will help with prevention of bladder infection. Women who are menopausal have frequent bladder infection due to low estrogen levels and thinning of vaginal skin, bladder wall skin, and easy transmission of infection into those areas. Hence, we often prescribe estrogen preparation topically in the vagina to prevent bladder infections in women who are in menopause. Most of the bladder infections come from bacteria in bowel, and taking probiotics may be helpful to prevent bladder infections, and certainly helpful to restore normal bacteria when you take antibiotics. Bladder infections can be treated easily. They are very, very unpleasant. There is a condition called honeymoon cystitis, and that occurs when women have a lot of sexual intercourse after a long period of abstinence, or when they start having sex for the first time. It can easily be treated. It's not forever, and your doctor should be able to help you with such condition if you develop one.